Good day. I'm Dr. K. Girish, physician, neurophysician, and neurosurgeon. This is RNA series number 37, Random Questions in Neurology and Neurosurgery, with answers by Dr. K. Girish. This, in fact, is to benefit the practitioners of neuroscience and the medical field for a lifelong learning, and also for public awareness. In this series, the question that I'm addressing is, what are the features of central cord syndrome? Well, central cord syndrome is the most common form of incomplete spinal cord injury. It typically affecting the cervical spinal cord. It is characterized by greater motor impairment in the upper limbs than in the lower limbs, often with variable sensory loss of the bladder and the bladder dysfunction. The causes for this are hyperextension injury of the neck, especially in older adults, with a pre-existing cervical spondylosis or a spinal canal narrowing. It can also result from trauma, example falls, car accidents, acute cervical disc herniation, syringomyelia, intramedullary tumors. The pathophysiology of the central cord syndrome. The central area, the spinal cord is like this, the central area of the spinal cord is more vulnerable, especially the gray matter and the central corticospinal tracts which are going adjacent to the gray matter. The upper limb fibers are located more centrally in the corticospinal tract. So they are more affected than the lower limb fibers. The motor weakness, more severe in the upper limbs than in the lower limbs. Sensory loss may include loss of pain and temperature sensation in a cape-like distribution over the shoulder and the arms. Bladder dysfunction, urinary retention or incontinence may occur. Spasticity and reflex changes may develop over time. Now, how do you diagnose this? MRI is the preferred imaging to assess the spinal cord compression, edema, or hemorrhage. CT or X-ray may show degenerative changes or fractures. The neurological examination helps determine the extent and the level of involvement, which will be very well be seen with MRI too. There is a conservative management with immobilization, high-dose corticosteroids for a short duration, physical therapy and rehabilitation, bladder management, and surgery is indicated in cases with a persistent cord compression or if there is an instability or when there is a progressive neurological decline. And the prognosis, better prognosis than other incomplete spinal cord syndromes. Recovery usually follows the order. Lower limbs will be recovering, then the bladder dysfunction, then the upper limbs, and then the hands. Younger patients and those with milder symptoms have a better outcome. So that's indeed the answer for what are the features of central cord syndromes. Thank you. Thank you very much.